Welcome to Public Affairs Roundtable, a discussion of current events in the nation and around the world and how they affect the people of Indiana. Here's your moderator.
Passing laws that restrict or prohibit smoking in public places, the American tobacco industry has introduced the element of smokers' rights, arguing that such laws are discrimination. Today on Public Affairs Roundtable, we'll look at the rights of smokers and non-smokers and what smoking is in America today. Our panelists are Nikki Turner, a Muncie physician and a critical care specialist at Ball Memorial Hospital in Muncie, Wayne Payne from the Physiology and Health Science Department at Ball State University, Beth Kelsey, who works for the Delaware and Madison County Health Departments administering a smoking cessation program of the American Cancer Society, and John Rouse, our producer and a member of the Ball State University Political Science faculty. John, the issue of rights is important here, or at least the tobacco industry says it's important. Do smokers have rights? Are they really rights?
Well, I think rights are things that are decided either in the political marketplace or in the private marketplace. And the rights of smokers are today being decided in both. First of all, the government, for example, has passed a ban as far as cigarette smoking in airlines are concerned. So that would be a focus upon the political marketplace or government focusing upon the rights of smokers or the limits of those rights. Now, also you find that the marketplace, private establishments are also exercising this question. So to try to answer the question, it is a political question. It is also a question for the marketplace. And so this issue is not yet decided.
Nikki, what do you think about smokers' rights?
Well, I think you have to look at their effect on other people. When I talk to patients and when I talk to people that are trying to quit smoking, I consider smoking a very selfish act, really. There is no smoker that, I mean, you say no man is an island, very brisk cliche, but the problem is a smoker does not smoke without affecting other people. Either affects him, if he lives alone, it will affect him, but it will also affect his family. It will also affect the government, the Medicare and all the insurance premiums that we have to pay and he has to pay. So no one smokes without affecting other people. It just doesn't work. I think smokers' rights, first of all, I consider smoking absolutely wrong. I see all the health effects from smoking. I see the secondary effects from the families that have to suffer through the patient's illness because of smoking. And so I think the smokers' rights, I think that's a smokescreen for the tobacco industry.
Well, how radical are you going to get? Would you say that smoking ought to be illegal?
Mm-hmm. Yes. Yes, definitely.
But the issue is that smoking is very legal. And a person has a right to do things in society unless it's illegal. So smoking is legal. Smoking has been around in this country since this country was started. The tobacco industry is reasonably new in the last 45 years, perhaps. But tobacco has been with us for 200 years. The
problem is tobacco is only legal because it was put under a specific jurisdiction. If tobacco was under the FDA, if the tobacco was not under the the firearms and tobacco area of government, I mean, a couple weeks ago, we hear that they were banning red food dye because it was put in cherries and fruit cocktail. And they had brought up all of these scientific evidence, all the scientific evidence that the red food dye was going to cause cancer in rats. There is, irrefutable evidence that tobacco causes cancer. It causes heart disease. It causes severe peripheral vascular disease, a direct relationship. It causes a number of different types of cancers. It causes prenatal death. It causes children to die earlier. They have higher risk of inner ear infections, pneumonias, all of these things. And yet I think the tobacco companies is losing, and they have to come into this rights issue. It's not a right.
Nothing that Nikki says has swayed tens of millions of Americans, Wayne. Who does smoke in this country?
Well, we have slightly less than a third of the population smoking now, and it varies on the basis of gender. Males still are a bit more likely to smoke than females. It varies on the basis of education and probably occupation as well. We certainly have seen a precipitous decline in the number of people, particularly men, smoking over the last 25 years since the Surgeon General's report in 1964. So it's a minority behavior in this, using the word to imply fewer rather than more people. So it's obviously illegal behavior, as John has said, somewhat paralleling alcohol, I think, in the sense that this is a product that has relatively few restrictions and is used by a large minority of people.
But when we adopt these laws, pass these laws regarding prohibitions, restrictions on smoking, you're affecting a third of the population. Sure. 80, maybe 80 million people in America who do smoke. That seems to be a rather significant.
I know, but you have to look at, why, we say heroin, we say crack, all of these things are detrimental to health. And yet, because smoking has been accepted in this country as a norm for hundreds of years, we say that is normal. It is not normal. The only reason it's legal is because when it came to this country and we were trying to put products under different areas of the federal jurisdiction and federal regulations, they were able to get, because we didn't know any better. Hundreds of years ago, we didn't know, or a couple hundred years, whatever, we didn't know any better. We didn't know the health effects of tobacco. The only reason it's legal is because it's put under this jurisdiction. If it was under another health effect, health jurisdiction, it would not be legal. They could not prove it. It's a very detrimental product, but because they've been able to keep it under this jurisdiction, that's why it's continued to be legal.
It might also relate to the fact that tobacco is an agricultural commodity. If you could extract the nicotine and some 2,000 other chemical components from tobacco and regulate them individually, you might have a situation in which it was in fact seen as a drug. So it's sort of an interesting combination of agricultural and pharmacological problem rolled into one, I think.
Beth, Fresh Start, which is what you're involved in, is a smoking cessation program. Is that correct? But that seems to be a big task, because the American Cancer Society wants to stop a third of the population from smoking.
Well, Fresh Start is just one program to help people quit smoking, and they certainly don't propose any great success rate even with their program. It's a 25 to 30% success rate after 1 year. And I think that when we talk about whether it should be legal or illegal, maybe we should look at it another aspect of public education and smoking cessation programs, rather than making it illegal, to help people to quit or to make them more aware of the ill effects of smoking.
How do you get people to stop smoking?
Well, they have to want to quit smoking, and they have to balance it. Obviously, if you smoke because there are some benefits or something you like about smoking. And what we need to do is to help them look at the pros and cons, so that they see that the cons outweigh the benefits of smoking. It's not easy.
If I could, I think that smoking, perhaps like drugs, people in our society, probably in any society, need an altered state of mind. And so what cigarettes give certain people is an altered state of mind. And as long as there's a need, perhaps by citizens, to change how they're thinking, or how they feel about themselves, or how they feel about their environment, they're going to attempt to go into this altered state of mind. However, the question is, do we use government to enforce these kinds of things, or do we use the marketplace? And I think the marketplace perhaps is much more effective in having a restaurant, which is a private organization, say, we will not allow any smoking in our restaurant. For example, a couple of months ago, I went into a smokeless bar in a very nice place in Montana, a ski resort. For the first time, I was in a smokeless bar. Now, this was a decision that was done by a private organization not to allow anyone to smoke in a bar. That, to me, is very revolutionary.
Society, it seems, has, in fact, as John said, or the marketplace has really put some restrictions on that. Have really come down on the side of the non-smokers, perhaps the anti-smokers, I guess, the tobacco industry. Are we moving in that direction, Wayne? Do you see us going toward a smokeless society?
Well, I would like to say yes, that we're going fully toward a smokeless society, but I think we're certainly going in the direction of smoking being a less than desirable component of one's overall behavior. Every month we receive a magazine that some of you know called Indianapolis Monthly. And in Indianapolis Monthly, there are some interesting little personal advertisements for dating partners. And every month I go through with a highlighter and I find all of those that specifically request non-smoker. And I've observed two things. Very few request a smoker, and about a fifth of them request a non-smoker. So I say to my students, probably the greatest liability of smoking as a young adult is not mortality and morbidity, not now, but the real problem is you're becoming a part of a discriminated against minority. And that might be the greatest liability that you have, and I think we're heading in that direction. Very few of my students indicate that they would want to marry a smoker.
But I find as a teacher that many students seem to smoke, or it seems to be a higher percentage than the people that I come in contact with.
Well, John, you may see somewhat fewer than the statistics indicate. I've seen statistics indicating that probably no more than 10 to 15% of university students smoke, and this compares to almost 30% of the general population. So, you know, maybe sometimes we see less than fully represented groups.
Nikki, what does smoking do to the body?
Well, it changes. Now, first of all, there's different forms of tobacco, and I think it's very important to point out that, and it's even more important now because I think the tobacco companies are really targeting younger people for different types of tobacco, like smokeless tobacco and chewing tobacco. Smoking itself, first of all, it does drop the oxygen supply to the brain. It cuts the oxygen supply by 40% for about 20 minutes. So that's one of the reasons why insurance companies are now coming out with lower rates for car insurance, because non-smokers have less accidents. They're thinking clearer. It speeds up your heart rate. It is a central depressant. You know, some smokers come in and say, well, I'm really getting anxious. I really can't do without this cigarette because of the nicotine effect. It really is a central depressant. It speeds up your heart rate. It raises your blood pressure. In the vessels, in the blood vessels, there's really an acceleration of atherosclerosis.
What's that?
Oh, sorry. There's narrowing of the blood vessels. There's plaquing. You know, we're always concerned. It's so funny. We're so concerned with cholesterol and all of these things, that the health effects of cholesterol. And yet smoking, really, it's like pouring gasoline on a fire. It just literally, and especially if the genetics are right, and in some individuals, especially with familial type of history where their parents have died early from heart attacks or severe peripheral vascular disease where their blood vessels have been really clogged up with cholesterol. These individuals have a very, very high risk of severe disease in their coronary arteries, their heart arteries, in their peripheral vascular disease, in their legs, in their arms. And one of the reasons I got interested in tobacco and the prevention of this is because I see all of these effects. The other problem is there are certain cancers that only occur in smokers. Squamous cell carcinoma is one. That's lung cancer. It occurs only in smokers. Oat cell carcinoma, another different type of lung cancer that only occurs in smokers. Now, other cancers can occur, and there's a higher risk of it. We know that there is a direct correlation between cancer of the mouth. 95 out of 100 patients that have head and mouth cancer, head and neck cancer, are smokers or use tobacco, either smokeless tobacco, chewing tobacco, or pipes. 95 out of 100 cases. We know that there's a very, very high risk of cancer of the esophagus, especially if you drink 1 ounce of whiskey or heavy alcohol a day. Very high risk. I think the statistics say about 40 times normal chance if you smoke 1 pack of cigarettes and drink 1 ounce of whiskey a day or heavy alcohol. There's very high. Cancer of the stomach, cancer of the pancreas, cancer of the bladder, cancer of the kidneys, all of these things.
Nikki, well, if that's so bad, and it is bad, again, why do people do those kinds of things to
Because they get addicted. I think the thing about that's why they're really, there's been a lot of information in the newspapers about the tobacco industry, the sporting events they sponsor, the Virginia Slims, the Marlboro, all the racing cars that have Marlboro, all over them, targeted all over them. The advertising. I think they really have to get to the young people, the uneducated and the young. because once they get addicted, it's very difficult to stop. I have a program that we started at Ball Hospital. It's called the Barney and Calvin program, and we, over the last 3 years, we've talked to around 10,000 children, and we go from first grade through the 6th grade. Just 3 weeks ago, I talked to a school in central Muncie, where the 3rd graders are up to 2 packs of cigarettes a day. And I mean, this is real. There's no school that we've gone into in the last 3 years that they have not had a severe problem with smoking in young children and smokeless tobacco. And I think the U.S. tobacco companies know this. They want to get these kids. Only 4 out of 10 kids, once they get started on smokeless tobacco, are able to quit because the addicting properties of smokeless tobacco. The nicotine is extremely addicting.
Yeah, you know, you say, for example, the sports advertising. The companies sponsor things like tennis, soccer, automobile racing, horse racing, even darts. But also in the last month or so, the cigarette companies have focused upon encouraging blacks to smoke by coming up with a package called Uptown. And then, of course, in terms of Beth's focus of a product by the name of Dakota, which focuses upon virile females. I guess I hesitate to ask what a virile female is, but that was is the focus. Now, of course, the Secretary of HHS came out against this, and of course they backed away from these products. But in the last month or so, there's been a focus upon trying to sell cigarettes to blacks and also to young people as well as poor people.
Yes.
Find vulnerable markets. Isn't that good American capitalism?
Certainly.
No.
John,
Go ahead.
John, let me introduce even a more insidious theme to advertising. I think one of the great fears of the American population, almost regardless of age, is obesity. And underlying a subtle aspect of tobacco advertising, I feel, is the message that smoking is a deterrent to weight gain. And some of the most frequently used words to describe cigarettes are also the exact words used to describe thinness: long, thin, willowy, probably directed largely to women and all people who really fear that should they quit smoking, they would gain excessive weight, or if they don't smoke, they're likely to at some point be heavy. So I think we're not only playing to minority groups in terms of blacks and to women, but even to people who fear weight gain.
Is it any wonder, Beth, that you have trouble getting people to quit smoking?
Or to stay quit? One of the things that we find, one of the more common reasons for relapse back to smoking is weight gain. We try to explain that, yes, you may gain 20, 30, 40 pounds, but still it's healthier for your body to have quit smoking. But in our society, it's not attractive to gain that 20, 30, or 40 pounds, and many women will go back to their smoking because they've gained weight.
Well, give me an example of how you deal with these people. I mean, you can't lock them away in a room and deny them cigarettes. It doesn't go cold turkey, apparently, or maybe it does. Give me an example or a case history, without using the names, obviously, of how you get people to stop. A success story.
A success story, okay. Well, obviously with the Fresh Start program is voluntary participation. And a lot of these folks are people that have tried many different times to quit, and their physicians have told them they need to quit. So they've come as a last resort to us. And we offer a lot of group support. And what we do is we look at what are your trigger situations that make you smoke? How are you addicted? What are some things you can do to cope with your withdrawal symptoms? And once you get through the quitting process, what are the things you need to be aware of that will cause a relapse? The stressful situation that makes you pick up the cigarette, the idea that I can just smoke one. We do see success situations, but it's difficult. Nicotine is an addictive drug.
So you appeal to their reasoning, their intellect, and you use some peer support to
right.
do that.
We motivate them with the reasons to quit. We give them the tools for behavior modification and a support group during that time to help them to get through the worst of the withdrawal symptoms.
If I can try to put this in an Indiana perspective, as I do from time to time on this program, at the best of my knowledge, there's not a big market for growing tobacco in this state. However, I think we should focus in terms of some of the prominent politicians that do have a stake in this. First of all, we hear a lot from Jesse Helms. Jesse Helms from North Carolina is very much a supporter. I guess the next industry besides tobacco must be basketball in North Carolina, so in that sense we have something in common with that state. Also, Senator Hollings from South Carolina is head of a very important committee that keeps this legislation bottled up as much as possible. Now, Wendell Ford is a senator from Kentucky, and he's also very much strongly behind the cigarette industry, so their supporters have been Senator Hollings, Senator Helms, and also Senator Ford from Kentucky. I think also in terms of trying to put this into perspective, we know that tobacco has grown, especially in North Carolina, in this country, and the markets, I believe, for tobacco are moving to the younger people, the people who are not educated, and I would say that the tobacco industry in this country must be moving towards the third world. So as we travel in Europe, we find that many Europeans continue to smoke, and they don't have the same kinds of concerns that we have in this country. Also, I would say in terms of the third world, that there's a real market for cigarettes from the tobacco companies in America in the third world countries.
John, at the same time, the tobacco industry is diversifying very quickly and broadly. So, you see at one level their attempt to market beyond the continent of North America and doing so successfully, and at the same time diversifying into any number of areas that seem at first glance to have nothing to do with tobacco, foods and entertainment and so on. So I think you're right that the tobacco companies are very concerned about maintaining what markets they have and covering themselves in other ways through diversification.
One might think, though, we are talking about economics. The health effects of tobacco are about $50 to $60 billion a year, and that has to do with early retirement, early disability, all the things that happen because patients or people smoke and use different forms of tobacco. So that's an incredible amount of economic pressure. I know that people say, well, what we need to do is, what are those farmers going to do in North Carolina or Kentucky instead of growing tobacco? It would be cheaper for us in the long run. I mean, we're talking about long term, like years down the way, especially when we're talking about young people. It would be cheaper for us to pay them not to grow tobacco than to pay the health effects of tobacco. We're now seeing there's been some studies looking at women that smoke when they're children, when they're pregnant in utero, and they are now seeing mild mental retardation because of the lack of blood supply. There's a cutoff of blood supply to the uterus for about 40 minutes, for about 20 minutes, by about 40% after one cigarette. And there's premature delivery, there's premature labor, all of these things. The health effects of this is incredible. These children are being mildly retarded, and we are going to be responsible for these children.
I think that's a good point. For example, we're encouraging the Colombians to grow coffee instead of coca. Are we also encouraging the tobacco farmers in North Carolina to grow something else, soybeans or something like that, instead of growing tobacco? And the point that you make gets back to Larry's point at the beginning of the program, the issue of rights of individuals versus the rights of society. And my figures show that the smoking illnesses in this country cost us $22 billion a year. So when the majority has to pay for the rights of the minority, I think this is when the controversy hits the road, so to speak.
All I have to do is go through and follow a physician. I see a lot of patients that have been very, very seriously ill. We're concerned about health effects. We're concerned about insurance costs. When you take a smoker that didn't give a darn about anybody except his ability to smoke, and he's 50 years old and he's had an anterior myocardial infarction, has had a severe heart attack, and goes through about $100,000 in one hospitalization, and yet you're sure that he hasn't paid that many insurance premiums. You know that. Who pays the rest of that? I mean, this is over and over. I bet you nickel, you can go in the Ball Hospital over here, any hospital, 50%, at least 50% of the illnesses, or the reason those patients are in the hospital is tobacco related, at least 50%. I'd be surprised if it's less. And yet we are all paying for that. And as you say, the societal rights should preclude individual rights, when we're talking about health effects, when we're talking about secondhand smoke, we're talking about economic effects. That $50 billion that we're spending on people because they've done something to themselves and we're having to be responsible for them could be easily paid on education, prenatal care for unwed mothers or women that don't have any money or any insurance premiums. All of these things. It's just incredible, the waste.
Let's divide this population into two groups. One group started smoking prior to 1964. Now this is a shrinking group due to age and mortality. This group could legitimately contend that they smoked when there was very little rational information to the contrary, versus a group more my age, for example, that made a decision to smoke after the Surgeon General's report. Should we treat these groups differently? Should one group be looked upon as being more victimized and one group simply failing to comply with sound scientific evidence to the contrary? Should we treat them differently?
I don't think so. I think just as a diabetic must learn to take care of their disease so they don't have long-term effects, whether you be 50 or 60 or 40 years old, a diabetic must accept its disease and must take care of it, or he will end up in the hospital or he will die. The same thing with a smoker. I have patients, I don't have patients presently, they've either died or I know other physicians have patients that have had they've had laryngectomies. We've had patients that try to smoke through their tracheostomy tubes. We have patients that have lung cancer that continue to smoke, despite the fact they know that their chance of recovery is much less. I think it has to do, like you say, education. But I mean, the whole thing comes back to legalities again.
Well, you know, I'm a little bit concerned because I produce this program. I'm concerned about balance, and in a way, I'm concerned that we have not been fair to the tobacco industry. For example, I did ask 3 different lawyers who smoke, prominent lawyers in this town, to come on this program and defend smokers' rights. They refused to do it. I think mostly out of a perspective of the market that it's not a very popular thing to do. But don't the tobacco companies have rights in being able to produce this? After all, it is legal. I mean, we should be concerned about the individual rights of people, that it should not be declared illegal. If anything, the market should take hold.
Well, why don't you talk about cocaine? Do the cocaine dealers have ability to sell cocaine?
But tobacco, in my way of thinking, is not the same as cocaine by any means.
Why?
It's similar to alcohol, John. I think there's your best analogy. Both are legal products, and it seems reasonable that if a case could be built against the use of either, the market would respond.
And we respond now by running out of time. Thanks to Nikki Turner, Wayne Payne, Beth Kelsey, John Rouse for being with us here today as our discussion of tobacco. I'm Larry Lough. Thank you for joining us.
I'm one of those persons.
Public Affairs Roundtable is produced in the studios of WIPB Channel 49 on the campus of Ball State University. The producer is John Rouse. Listener comments are welcome.